Hi everyone, my name is Peptic Ulcer, health consultant. So today we'll be talking about a very important question. This topic is about ulcer. Yes. So people say, oh, don't eat pepper. Don't eat pepper. Pepper causes ulcer. Hunger. If I don't eat, I will have ulcer. It's a lie. I'll tell you what causes stomach ulcer today. Okay, welcome back. So today we'll be talking about stomach ulcer, like everything about stomach ulcer, like you will understand what really causes your ulcer. So when we talk about ulcer, we are talking about like ulcer is like a kind of wound in the stomach, and this kind of wound in the stomach in the sense that it is caused as a result of something eating up the stomach lining. Like the stomach has a lining that protects the inner tissue. So when that lining is eaten up, then the stomach is exposed. So you just imagine a kind of like, you know, when you pour acid on something, see how it foams, like that ash reaction. That is what happens in your stomach whenever you have ulcer. Your stomach tissues are exposed, and then the gastric juice, the acid that is needed to digest your food, is being released, and it gets to attack your stomach tissues, and then causes the pain that you usually feel, like those burning pain. So the major thing that causes the damage of the stomach lining is a kind of bacteria. So it is not hunger that causes your ulcer. It is a kind of bacteria known as Helicobacter pylori, which is known as H. pylori, and this is like the common, like out of 100% of causes of ulcer, this is 80% causes of ulcer. That's why you don't just treat your ulcers with antacids alone and just maybe use your omeprazole and all of that. You need to like supplement it with something so that your ulcer doesn't go and come back, like you manage it effectively at once. So H. pylori is the major causes of ulcer, and this is as a result of contaminated food. At times you can get it from drink, at times you get it from used cutlery, like when you tend to share cutlery with people, and sometimes it's gotten inside saliva, like you know, bacteria now, like they are invisible microorganisms that you can't see. So this is a major causative agent of ulcer. Then the 20% based on research is as a result of medications. At times the major medication that causes ulcer is NSAIDs, and this is your common painkillers. When you abuse painkillers, you tend to develop ulcer from it. Painkillers like ibuprofen, your diclofenac, and whatever it is. So now what's the major causes of ulcer is H. pylori and NSAIDs. So symptoms of ulcer include burning sensation in your chest region or in your stomach. Then another symptom could include feeling bloated, like just feel too full of food, like, and then you are finding it difficult to digest your meal. And another symptom could be dark colored stool. Another symptom could be vomiting of blood. Then another one could be nausea and all of the rest like that. Like when you now start having 2 or 3 of the symptoms, then you should take note that you might be having ulcer. Then let's go on to the types of ulcer we have. Take note, we have different types of ulcer, but this particular one we're talking about is stomach ulcer, also known as peptic ulcer. And under peptic ulcer, we have 2 different types of ulcer. We have the gastric ulcer. This one occurs in the stomach, and the kind of symptom, the way you would even identify it is when the pain keeps increasing after you've taken food, then you still keep feeling the pain. That is gastric ulcer. And then the second one is duodenal ulcer. This particular one, the way you could identify it is when you get relief after eating, and after some hours you start to feel the pain. Like you eat, after a few hours you start feeling the pain, then that is the duodenal ulcer. And these 2 kinds of ulcer can be treated like the same way, because their causative agents are the same thing, which is H. pylori, Helicobacter pylori. How do you manage your ulcer? The first thing is for you to go for tests. Like go for tests, let them be sure that there is a bacteria multiplying in your stomach. So after getting tests and maybe you find out that you have the ulcer, then your healthcare professional might have to like administer antibiotics for you, because antibiotics will get rid of those bacteria that are multiplying in your stomach, which is known as the H. pylori. Once you're able to get rid of these bacteria, then you are free from ulcer, just only for your stomach lining to heal up, and then you're good to go. And so they would have to administer antibiotics such as amoxicillin, ciprofloxacin, depending on what works for you. The healthcare professional would decide that for you. And then another way you could manage your ulcer effectively is eating regularly. Don't miss your food. This is the trick. If you miss eating your meal, this is what happens. The gastric acid tends to be released during that period whereby you're feeling hungry, during that period whereby food is not going through your system, and this causes intense damage to your stomach and causes the intense pain you feel, and you think, oh, because I'm not eating, that's why I'm having ulcer. So this is more reason why you have to eat regularly, even if you are diagnosed of ulcer or not. Make sure you eat regularly. Do not skip your meal, except maybe you're undergoing some intermittent fasting or whatever it could be. And then another way of managing your ulcer is having a proper hygiene. Like if you are to share cutleries or whatsoever, make sure it's a clean cutleries. Make sure you drink clean water. Make sure you eat from a clean plate. Make sure you eat food clean to prevent you from having ulcer, maybe from the H. pylori, because bacteria are usually transmitted from contaminated substances. And make sure you have enough rest. Yes, there can be a stress-induced ulcer. You don't want to know about that, do you? From today, your healthcare professional might need to administer antibiotics to you alongside with your omeprazole, cimetidine, your antacid, Gestive, Supermag, and all of that. So I hope you were able to learn one or two things today. Please make sure you know the cause of your ulcer, so for you to be able to manage it effectively and properly. So that'll be all for today. Please stay tuned for the next episode. Do not forget to like, share, and make your comment. I'll be waiting to see your comments in the comment section. Bye.